So one of the interesting studies that was presented was a regimen that omitted steroids for patients with newly diagnosed myeloma that were otherwise considered frail. So these are people above the age of 80 who have other comorbidities, who wouldn't necessarily be served well with aggressive regimens. There was a trial in which people basically got, it was either a combination of two drugs, daratumumab and Revlimid, versus Revlimid and steroids. So basically one of the arms doesn't have steroids in it, and that is such a big accomplishment because we all know that our patients hate the steroids, and it sure looked like despite omitting steroids, that regimen was still fairly effective and was fairly safe. So that's something that we're very excited about, and it definitely lowers my threshold of like trying to get rid of steroids as soon as possible. So that's one thing. And then there's some really simple things, but that are very profound. So for example, when we put our patients through a stem cell transplant, a lot of institutions in the US put them on a very restrictive diet, right? What we call a neutropenic diet, or a diet with precautions. They're not allowed to eat like, fresh fruit, fresh vegetables, things have to be cooked a certain way. So there was a trial that basically compared that restrictive diet to a more regular diet, and it looked at whether the incidence of infections or other complications was any different, and it showed that there was no difference in those complications, and patients were a lot happier with the regular diet. It is such a simple concept, but it's such a profound concept with such widespread implications for so many people. So I'm very happy about that. That changed my practice immediately, right? I go in there, like if I see that the patient I'm taking care of is on one of the restrictive diets, I'm like, you're going through cancer, you have enough on your plate already, we don't want to like add additional restrictions. So it's really simple, but it's really, really profound. Those are like important things for patients early in the treatment journey, but later on in the treatment journey, we do have some really new exciting drugs that are at early phases of development that appear to be fairly promising, where previously these would have been situations where we don't have a lot of good options to offer, but now it definitely looks like we're getting more and more drugs in the pipeline. A lot of these drugs are not ready for prime time yet, but they likely will be in the years to come. So lots of really exciting things, but I think at least as far as newly diagnosed myeloma is concerned, it's really simple things that are going to impact my practice. Simple for me to do, but really profound in the impact that they can have on our patients' lives.